For the latest on that hospital staffing bill that we told you about last week, it basically is a compromise between Oregon hospitals and the nurses union to create nurse-to-patient ratios to hopefully help ease the staffing burden in hospitals all across the state. It's called House Bill 2697. It's currently with the Joint Committee on Ways and Means, that's the money folks, and it passed out of a House committee with a recommendation to pass the bill. Right now, there are not any scheduled hearings or votes upcoming, but we assume it will at least have a hearing on the floor of the House in the coming weeks instead of withering away without a hearing or a full vote. Here's a look at some of the nurse-to-patient ratios it would implement. In an emergency department, 1 nurse for 1 trauma patient. In the intensive care unit, 1 nurse for every 2 patients. You can see there are several other different ratios, so I'm not going to read them all off right now. But for nurses in the pediatric unit, it's 1 nurse for every 4 children. And several of you wondered about medical surgical units, commonly called med-surg. We don't have that on there. That would also be a limit of 4 patients for every nurse. Now, following our segment on Friday, we asked about your thoughts on the bill, and one comment that really helped bring some more context to those ratios we just mentioned is this one. It isn't just the face-to-face time they spend with a patient. They also have to review the medical records of a patient, record everything they do with that patient, meds given, condition changes, etc. I didn't understand why 4 to 5 patients in a nurse's 12-hour shift was so much until I asked my RN niece about it. So that is something to consider when you're making up your mind about what you think about this bill and the ratios. And to be honest, we didn't get any responses that were against the bill. Some of you did wonder about the financial implications and if it would cause hospitals to reduce their services, and that is something that is sure to be hashed out in Salem. In the meantime, let's get to a voicemail from a viewer named Wendy.
Definitely in favor of a decent patient-to-nurse ratio. Our nurses work so hard. It's not fair to overload them so they can't take care of the people they need to take care of. I certainly hope the bill passes.
And we heard several stories from nurses in the area when it comes to staffing, echoing what we heard before. Overworking nurses, not good for them, not good for their patients. One RN who's been in the field more than 20 years told us, as a consumer of health care, I would be terrified to have to go to the hospital where I work for care. And I am so sad I feel that way. I know my coworkers would do all they could to care for me, but they don't have the staffing to do it safely. Wow. And the former executive director of the Oregon Nurses Association brought up a point that many of you shared with us as well. And obviously she does take a certain position due to her old job, but she wasn't the only one who was saying this sort of thing to us. There is a significant amount of money spent by hospitals on layers of administration, consultants, and activities that are not directly supportive of the care that patients need. So while hospitals are currently on the whole reporting a deficit in profit margin, many have reserves that can clearly be spent in a crisis. And finally, let's end on this email from Marilyn, who told us she's been hospitalized with life-threatening issues twice. Nurses care for their patients with compassion that is unmatched in the healthcare arena. If we lose our nurses because we have overburdened them, we have lost human connection, skill, and most of all, healing. That would be a very sad day for humanity. Even though the hospitals and the nurses union agreed to the compromise, it's all up in the Salem now to the lawmakers. It's up to the lawmakers in Salem. We'll keep an eye on the bill and keep you posted on its future. And now, from the folks who do important work every day to save lives to the legal authority that many states have to take lives. Washington became the first state on the West Coast to remove the death penalty from its law books. We'll tell you more about the special guest that Governor Inslee had alongside him when he signed the bill to make it official. That's when the story returns.